Today's presentation is on exercise and how that may benefit you if you're going through cancer treatment. So when I was at university, one of my part-time jobs was an allied health coordinator at a local Icon Cancer Centre. And that role basically entailed going around talking to all the patients and seeing if I couldn't organise any sort of allied health help for them to help them through the cancer treatment process. And that may have been in the form of exercise physiology service, it may have been in the form of physiotherapy service, and it may have also been in the form of occupational therapy service if the client needed it. However, the common trend that I found doing that was the ones who were exercising were far outperforming those who weren't exercising. And I mean that in the sense of, A, they looked a hell of a lot better than those who weren't. They had more muscle mass, they had more color about them, they had less cancer-related fatigue, and were generally dealing with the whole ordeal a hell of a lot better than those who weren't undertaking any exercise therapy. So I'm hoping today I can shed some light on why that might have happened, and if you are going through cancer treatment, hopefully inspire you to go and seek professional help and help you, aid you through that process and get a far better outcome. So the first benefit that you may receive if you do an exercise therapy program while undertaking chemotherapy or any sort of cancer treatment for that matter is increased tumor blood flow. So researchers used mice for this one and had a group that were allowed access to a running wheel and one in a group that wasn't allowed access to a running wheel. And what they found was the mice who had free range, who could run on the treadmill for as long as they want, I think it was about 4.6 kilometers average in daily that they covered on the treadmill, increased tumor blood flow by about 200%. Now, why this is important is because a lot of treatment therapies rely on blood flow. So if you can increase the amount of blood going to the tumor site, hopefully we can increase the amount of treating agent actually going to the tumor itself and destroying the tumor. The second benefit that you can get from exercise therapy is an increase in immune function. So again, researchers used mice, and what they did was they injected the mice with a substance that I'm going to abbreviate to DEN, and this substance is known to increase, it is known to develop tumors in mice. So what they found was the mice who exercised, who had the injection, it decreased the tumor size by about 60%. And it also decreased the incident rate at which the mice would develop the tumors. Now, what I mean by that is, of the mice who were injected with the substance and they weren't allowed to exercise, 75% of those developed a tumor. Compare that to the mice who were injected but were allowed to exercise, only 31% of them developed a tumor. So there's clearly an increase in immune function when the mice were allowed to exercise. And what the researchers posed was the mechanism for this is when we exercise, it releases epinephrine. This increase in epinephrine seems to stimulate the natural killer cells that are within everyone's body that seek out and destroy tumors. And that's their main sort of a role. Now, when we exercise, the exercising muscle also releases a key chemical called interleukin-6. And this interleukin-6 acts as like a homing mechanism for the natural killer cells. So the interleukin-6 will come out, bind itself to the tumor, which then attracts the natural killer cells to the tumor site specifically. And that is why we have that 60% reduction in tumor size and a reduced incident rate among the rats. The third benefit from exercise is an increase in muscle mass. So this is really important for individuals who are going through ADT therapy, specifically men, as that will obviously reduce the amount of testosterone the man has. So it was previously thought that maybe exercise wouldn't be the best thing for those individuals, seeing as we're trying to reduce testosterone levels, hence why they're on that therapy. But it's been found that exercise is actually extremely safe for these patients, and it can also increase their muscle mass even with the reduced amount of testosterone going through their body. Unfortunately, there's no pharmacological treatment that can increase muscle mass, and only specifically prescribed exercise can do so. Another benefit of exercise therapy going through cancer treatment is an increase in bone mineral density. And again, this may be beneficial for older women who have already got osteoporosis, or men on ADT therapy who may be at risk of developing osteopenia or osteoporosis. So the very basic crux of how exercise can increase bone mineral density is about mechanical loading. So if we can place greater strain on the muscle to the point where we don't push the biological envelope and cause a fracture, but stimulate the growth, we can most definitely increase bone mineral density, and it has been found that we can in individuals going through cancer treatments. Cancer-related fatigue is one of the most complained about symptoms or side effects of the cancer treatment process. When I was the allied health coordinator at Icon Cancer Center, like I mentioned before, that was definitely the biggest obstacle I found in trying to convince people to undertake cancer-related therapies, as they would complain they had no energy to actually perform any exercise. So it's kind of a double-edged sword. If you don't exercise, your fatigue is going to stay there and probably get worse. However, if you do exercise, somehow you have to muster up the energy to actually do the exercise therapy. So it may be beneficial to start looking at and doing the exercise bouts in small, doable doses and delay them over the period of the day. So it might be 10 minutes in the morning, 10 minutes in the afternoon, and then 10 minutes in the late evening. And there's your 30 minutes of exercise for the day. What we believe causes the fatigue is, well, one, the cancer treatment. It's quite nasty stuff. Two, the decrease in muscle mass that I mentioned earlier. And three, a decrease in ATP production due to the treatments. How exercise can reduce those side effects or make those side effects less inhibiting is obviously increase muscle mass, increase aerobic fitness, and hopefully increase ATP production as well. So that's pretty much it for today. If you guys have any questions, feel free to shoot me a message. I'll leave the references in the description below, so you can feel free to have a read of those in your own time.